Hello everybody, Dr. JJ here. Thank you very much for watching and listening. Today we're going to be talking about intravenous vitamin C, so IV vitamin C. A great treatment. I've had vitamin C treatments. I've done a bunch of them today. I think they're great, so we're going to get right into it and talk about some IV vitamin C. A little bit of reading over here in your spare time. So a very good reason to do IV vitamin C would be for your immune system. I'll find patients that are prone to getting sick. Think of hospital workers, nurses, teachers, daycare workers, flight attendants, etc. So we'll use some vitamin C intravenously just to bump up their immune system and support their immune system, and they often find that useful. Another good reason to do it is for infections, bacterial infections, viral infections. Vitamin C has had some benefit in terms of upregulating the immune system. I've used it for a slew of different types of infections, ureaplasma, flus, herpes, more severe infections, and I found it to be useful. So infections is definitely a good area to use vitamin C. Eye conditions, there's been at least some data in terms of preventing cataracts with vitamin C, mostly oral vitamin C, but IV-wise I found it to be useful for eye conditions, especially when you pair it with IV glutathione. So something for you to think of if you folks have an eye issue. Adjunctive cancer support. High dose vitamin C, so I'll get to that in the next few slides. Adrenal support, vitamin C concentrates in your adrenal glands, also very useful for energy. So people that are overworked, burnt out, they tend to find that vitamin C is quite helpful. So we'll do a fair amount of those, either in the form of an adrenal IV or an energy IV or just a higher dose vitamin C IV. People have found that to be helpful. Longevity, people want to live healthier and longer too. So vitamin C being an antioxidant has a lot of different health benefits, and just for the general maintenance of good health, because it's got a lot of great properties to it. High dose vitamin C. So the reason why we would go with a higher dose vitamin C treatment versus oral is because if you take a lot of oral vitamin C, you'll start to get diarrhea. It depends on your body weight, depends on what you've eaten with the vitamin C, but if you take huge doses of it, it's usually going to run right through you and cause some diarrhea. Typically per dosing, so usually per meal or per dosing of vitamin C, usually anything over 2,000 is not as well absorbed. So past that, you absorb less and less of it. What you could do for those of you who want to continue with oral vitamin C is you could spread it out throughout the day, like a breakfast, lunch, dinner type of thing. But usually to achieve higher doses, and when I'm talking about higher doses, I mean things along the line of 25,000 milligrams, so 25 grams, 50 grams, 60 grams, etc., which we're normally using as an adjunctive treatment for cancer patients. You need to do this intravenously. If not, you'll be getting the runs. Now, to do these tests intravenously, you must have a normal G6PD test. So a G6PD deficiency is not very common. I've seen maybe 3, I think, in 20 years. This test must be normal. If not, your red blood cells are more susceptible to hemolysis. So what that means is that they're more likely to break down when faced with like a huge amount of vitamin C. So this would not be a treatment for you if you had a G6PD deficiency, but not a common thing. But nonetheless, this is a blood test you would need before you'd be able to proceed with high dose vitamin C. We'd also want to make sure your kidneys are okay. If you're prone to kidney stones, that's something we'd be on the lookout for. Or if you have one kidney or you have chronic kidney disease, we wouldn't want to give you too much vitamin C. Electrolytes, CBC, liver panel, so AST, ALT, ALP, and GGT, also types of tests we'd want to see before we'd start with an IV vitamin C. Risks, it's usually pretty well tolerated. I mean, obviously there is a needle going in you, so if you're afraid of needles, this isn't for you. It does decrease your blood sugar. So what happens is when big doses of vitamin C enter the blood rapidly, you tend to get a release of insulin from the pancreas, so that dips your blood sugar. So as long as you've eaten before, you've had a good solid meal, breakfast, lunch, etc., patients usually tolerate this very well. When you're into higher doses of vitamin C, like a 60 gram or a 75 gram, etc., you normally need to eat during the IV. If not, you could feel a bit lightheaded. And lastly, before you would begin this therapy, you'd obviously need to speak to a naturopathic doctor, such as myself, to make sure it's the right treatment for you. So wonderful. Thank you very much for listening. I hope you've enjoyed. And again, this is Dr. JJ from AskDrJJ.com. Have a lovely day. Take care.